You're now South Beltway. I'm John Fredericks, and I am your blowtorch of free speech in America. Joining us now, my favorite doctor in the history of doctors, Dr. Peter McCullough. He's been right about everything. I told you this before. He's like the Ted Williams of Ted Williams hit 420, right? 407 or something like that. Dr. McCullough's batting 1,000. How do you bat 1,000? Everything he said is right. Everything predicted came true. Everything he said wouldn't happen didn't happen. The guy's been right about everything. He's been banned. He's been censored. He's been skewered. The whole thing, but he's back now, and he has been on target. This is why I love having him on. This guy's a visionary. Dr. McCullough, thanks for joining us today. Chief Scientific Officer, the wellness company, the company that you're founded, your vision. I want to get right to it, though. The HHS, another one of our weaponized departments, they're expanding emergencies, right, whatever that means, to include all influenza A viruses. So they can have another, government shutdown or mail-in ballots, or you're going to die if you try to vote, so you got to get a mail-in ballot, or whatever they're doing. Explain that to us.
July 24th, HHS Secretary Becerra used a prior obsolete strain of influenza, the H7N9 strain, and said, well, that's in a class of influenza A, so I'm going to make influenza A the entire class of viruses there under emergency use authorization. So this is important because about 75% of all seasonal human influenza is influenza A. The current avian influenza or bird flu is influenza A. So this gives the government broad sweeping powers to say the next influenza season's an emergency, and they can enact all kinds of what's called biosecurity measures.
And so what will be the objective of that? Like, what is the government's objective here, in your view, Dr. McCullough?
I think it's a rapid track for Moderna's influenza and their avian influenza vaccines. It also gives them broad powers, again, for lockdowns, mask mandates, to do really anything the government wants to do related to influenza A.
This guy Walsh in Minnesota, I think he's bat crap crazy. That's just me. A lot of people calling him, I don't know, the Midwestern dad or something. Have you looked into some of the policies this guy has as it relates to COVID, vaccines, et cetera, Dr. McCullough?
He didn't get very good advice, and he certainly didn't follow, good judgment. He had policies in place where there were, indoor and outdoor mask mandates. You couldn't have more than 10 people at your house. Inside, more than 25 people outside. There were $1,000 fines for that. Had a policy where neighbors would snitch on each other. There was a hotline, and they would call in and snitch on each other. And he took this opportunity to basically declare, in a sense, public health martial law in the state of Minnesota. And there was a tremendous backlash against it. We didn't do any of that in Texas. It was the same virus. We got through it just fine.
So what is, when you look at the number of people that took the COVID vaccine, and we always like to talk about this because it's real, and a lot of our audience doesn't realize, a lot of them watching it now didn't take it, but depending on what poll you look at, between 83 and 85% of all Americans took at least one shot because the way it was promoted, the money that went behind it, you couldn't keep your job, you couldn't visit your children, you couldn't go on an airplane, all this stuff. So people got it. It's 8 out of 10 people got it. What concern that should they have now, and what should they do?
COVID states program said 75% of people got it. Updated CDC numbers, Rasmussen survey data, it's coming in somewhere around 75 to 80%. So of those individuals, remember there was only a theoretical benefit. So if you took the shot, but you didn't come in contact with COVID the next few months, then it didn't matter because the vaccine, its benefit wears off. If you previously had COVID, then the natural immunity would carry you, not the vaccine. So the vaccine benefit was only theoretical, but the harms were real. what we know is between 5 and 10% of people were truly harmed. They developed a vaccine injury syndrome of some sort. That means 90% of people are fine, John. So, people in my family took the shot. I'm watching them carefully. They appear to be fine. So I think we need to focus on people who really have, symptomatic syndromes, and there we apply the detoxification protocols and other treatments.
Dr. McCullough, let me ask you this. I find this to be just mind-boggling. In Finland, they've mandated a vaccine now for the bird flu, right? In Finland. And when you read the vaccine cautionary thing that's on all drugs, it says that you have a 1 of 200% chance of death, not injury, not you might get a pain in your back, not you might get a symptom like a headache. It says right on there, 1/200 chance you can die. Why on earth would anybody take this thing?
This is the CSL Audens vaccine, Sequarius vaccine, and it's shocking. In a normal human volunteer study, these are normal people. People died in this study due to the vaccine. It's right in the package insert. It should have never been FDA approved in 2021, and the Finns should not be using it. The EU purchased up to 40 million doses of this dangerous vaccine. It's an antigen-based vaccine. I can't imagine how dangerous Moderna's messenger RNA vaccine will be for avian influenza.
I mean, 1 in 200 chance I'm going to take a vaccine that, like, even the bird flu doesn't do anything anyway, and I'm going to take a vaccine with a 1 in 200 chance of dying? I mean, that's like playing, like who would do that? And how could the Finn government even be serious about putting this thing out? I mean, this is a state of mind that the world has now gone in, that somehow these vaccines are going to save you, and, better I die 1 out of 200 than I get the bird flu and get like a cold or something. I want to get to a couple things. I know we talk a lot about your emergency kit, and you've added some stuff. I'm going to get to that in a minute. But one of the things I want to talk about is very real in our family, which is the doctor subscription service that you have. So I've used it myself and my family, Anna and Joe, 5 times. Our doctor is Dr. Bradford, where we have been late at night or something has gone on or on the weekend. And, rather than go to the clinic or, go find a doctor, we subscribe to the service. We call up. Bradford FaceTimes us back. We've got the prescriptions that he prescribes right here in the medical emergency kit. So I don't even have to go to Walgreens or CVS or something in the middle of the night. But we just call him up, and it's telemed. And my experience with that has been a 10. Like, I had a problem with my hand. I couldn't bend my hand, so I had something going on. Obviously, I had to go to the regular doctor, make an appointment, get an x-ray, and all that. I think I got steroids for it. So you still have to do that. But I just want you to explain, if people sign up for your service, they actually get a doctor that they can FaceTime, and they call them right back, and they can diagnose what's going on. And the majority of the time, it's right here, right in the emergency medical kit. Can you just take a minute explaining what your vision is for that? Because I've had tremendous success with it.
People should go to twc.health.com and sign up for one of the One Wellness programs, and they're different levels. The highest level actually includes the prescription drugs and the supplements, actually unlimited, which is wonderful. And you're right, the telemedicine service, you get the doctor on the line. You have Dr. Bradford, who's terrific. And, it doesn't take much to kind of, with sophisticated patients, walk you through the problem. Many times the drugs that are needed are right in the emergency kit. You're right. And there's 4 different kits. You had the broad aqua green one. That's the one I've had for a long time. Now I've got actually all 4, which is wonderful. But the idea here is that, a simple urinary tract infection, a yeast infection, a bronchitis, spider bite, all of that should be handled without an emergency room or urgent care visit. You can save a bundle by having one of these emergency kits on hand. And if you use the medicine, John, you can actually get refills.
Well, we just did that. We just got a refill because we use it so much. But I encourage everyone, every household should have this, especially with the drug shortages coming up. And again, we've used it real time 5 times. Some of them were pretty bad. Just the other day, Ann had a spider bite. Her elbow blew up. Sunday night, we know what's going on. Call Dr. Bradford on Sunday. Calls us back, examines it through FaceTime, prescribes something right in here, problem gone. All you got to do, folks, this is real, is go to twc.health, twc.health/Godzilla, twc.health/Godzilla. You can sign up there. You can get your medical emergency kit, put a promo code Godzilla. You're going to get 10% off. The bigger thing is, this is the new way to do medicine. And it gets you, look, I'm 66, so I've got whatever that thing is called, right? I've got Medicare, so I've got that. So I can go to the doctor and pay $10, whatever it is. But this is the new way to do medicine because you're outside the system. You're outside that nonsense, and you get a real doctor that understands what, and then you get a relationship with him like we had with Dr. Bradford. But the thing is, even if you don't want that, have the medical kit on hand. Something happens, everything is right there. You can get refills like we just did. Just go to twc.health/Godzilla, promo code Godzilla. You're going to get 10% off. Doc, this is really visionary. I mean, we talked a long time ago about telemedicine and how that works. But when you can get the wellness company doctors outside the system to be able to call in, get a relationship with you, understand what's going on in your family, this is one of the best things out there. I mean, why go to a walk-in clinic, wait there for hours when I get a call back in 10 minutes right in my home? twc.health/Godzilla, promo code Godzilla, get 10% off. Dr. McCullough, thank you for all you do. Thank you for your vision. I'll be right back.